Hi, everyone. I'm Dr. Elisa Bronfman. I'm a psychologist with the Family Medical Coping Initiative, and I'm here with my colleagues, Annie Banks, a clinical social worker on our team, and Gail Windmueller, our certified child life specialist. So, welcome to all for today's topic, which is managing big feelings and behavior in a medical setting. So, we're hoping to give you some ideas and resources to manage it when you come to a hospital appointment or a setting. We know it can be stressful. Whatever you're coming for, there could be some stress for you and your child, and we're going to give you some strategies to both understand and manage those feelings. I'm just going to give you a little rundown of what our talk today will be. First, we're going to start with why is this a hard setting to be in, a medical setting, and then what is that misbehavior and what's the behavior we're looking for. We'll talk a little bit about the role of development in child misbehavior and feelings in the setting, and also how caregivers can help prepare children for coming to an appointment or a medical visit. Then we're going to get to, like, what are the things you really shouldn't do, the things that can make it worse at an appointment or a medical visit, and also things you can do, of course, to make it better. We're going to end with some resources, so there's going to be more to read if you would like, and more to watch if you would like. With that, I would love to start with a question to my colleague Annie. Annie, why do children struggle in a medical setting?
Oh, Elisa, thank you for the question and the introduction. And first, I have to say that um, we have all been there. Those of us in the Family Medical Coping Initiative, when our kids have not acted as we expected or hoped in a medical setting. We're all parents, and Gail is actually a grandparent. And we know it's very hard when your child doesn't act in a clinic or a hospital as you had anticipated, and it can sometimes even feel a little bit out of control. What we do know is that behind all of the big behaviors that we see from kids, are big feelings. And it's really important to learn what those feelings are behind the behavior so that we can address the actions, in a more compassionate and meaningful way, right? So, some of the reasons, I'm going to give you a list of reasons here, but some of the reasons children might misbehave in a medical situation are first, frustration. And fear are extremely common. Frustration, of course, because it's usually not their choice to be there in a medical visit or a medical setting. They might not like it. And fear is extremely common. It can be a very unfamiliar environment that has unfamiliar equipment, sound, sights, um, smells, and unfamiliar language. And there is a story that Gail has told me a number of times. I'm going to steal it from her because I think it's so good in terms of how to understand how unfamiliar language can actually be really hard for kids. There was a girl who heard that she was going to be coming to the hospital to be put on a stretcher, and was going to be put on a stretcher, and you and I know that a stretcher is a gurney with wheels, but she thought she was going to be put on something that was going to stretch her body. I mean, that sounds terribly scary and painful. And so some of those misunderstandings can create a lot of discomfort for kids and result in a lot of behaviors. There's also fear of experiencing pain. That can be the pain of a shot or poke, as we like to say in Family Medical Coping Initiative, or just previous negative experiences in a medical environment for which a child really wasn't prepared in advance. Stranger anxiety is pretty significant at some stages of development. And there are lots of new people, or can be, in medical environments. And yes, we think of doctors and nurses, but if you think about it, it's front desk staff or phlebotomist or the radiology tech or respiratory therapist, or even, a social worker, psychologist, child life specialist, right, are new in a medical environment, just to name a few of those people. And that can feel a little overwhelming for some kids. And certainly there's discomfort with body touching, nudity, and personal questions. And if you think about it, We tell our kids in almost all other areas of their life to be modest, to not show their bodies, and certainly to not trust people who ask them to or who ask them probing personal questions. And so this is a really different a way of being, to be in a medical situation where people are requiring that of you. And of course, many kids just don't understand how to be in a medical setting. They're not familiar with it. They don't know that they're not supposed to run around in a waiting room or a hospital. And this can be due to, of course, inexperience. It can be due to intellectual disability, autism, or some kids have some sensory issues that make it harder to understand what's happening in a medical environment. That's a long list.
It sure is,
Yeah.
wow, and also, I always think because I work at Boston Children's Hospital, I love coming into the hospital. It's a very relaxing place, and it's a good reason a good reminder that it's not that for people who are coming for medical visits, so I always
Yeah.
remember that. So, when you're thinking about that, what are the misbehaviors that you're talking about?
Mm. So even to define misbehavior, you might think that's pretty obvious and easy, but actually, even in the Family Medical Coping Initiative group here, we were talking about it, and we have some different ideas about, what misbehavior is, and what kinds of behavior can be problematic in a medical setting. So, just to be clear, what we define as misbehavior is certainly based on values. And I work in the Center for Families at Boston Children's, and as you might guess, we see a wide variety of families and children's behavior, and that's based on differing values in families. And even defining what's difficult or problematic behavior can differ between caregivers in the same family, right? As to what should be addressed. So we kind of came to a consensus here among the three of us that really the bottom line is safety, and that the child has to be safe, and those in the surroundings have to be safe. That's kind of the bottom line in terms of it's misbehavior if that really isn't happening. So what do we consider misbehavior? Running and hiding, not following instructions or refusing kind of adamantly to engage with requests, um, engaging in behavior that isn't expected or customary in a medical setting, which I often call like the playground type behavior, climbing up bookshelves, running races to let off steam, throwing food or toys might be unexpected. Certainly making disrespectful comments, swearing, or making fun of others in the setting. And I think then the things we kind of consider as really tantrum, parts of tantrum like behavior, yelling, screaming, kicking, destroying property, acting aggressively with others, such as spitting, biting, scratching. And then there's self harm that kids can engage in, including tearing their own clothes. So these are all very big behaviors to manage.
Oh, it's so sad when you think of what they must be going through when they're engaging in those behaviors and you really sort of think about their experiences. But I guess I'm thinking about what is the behavior we're looking for? What is that so-called good behavior?
Right. So even as we weren't in like complete agreement on what misbehavior is, we kind of had to have a big discussion among ourselves, like what ideally is good behavior? What are we expecting of kids? I mean, we usually think of good behaviors as those that are related to kind of quietly adhering to what's required of the child, not pushing back, not causing a ruckus, so that exams and procedures can go smoothly and don't require extra time in what is usually a very busy setting. So there are behaviors that don't cause distress to others in the setting. And again, I will say that can be, expecting a lot of a child. Most children have a lot of energy, and that can be very difficult to manage in a medical setting. So I also want to say that, even thinking of quiet behavior, following directions, um, and being compliant, is that always good? It's certainly easier for all of us. But the other thing to think about is what are the feelings behind that behavior? And even on the outside, if the child is showing some good behavior, is there any fear underneath that, right? Or sadness or concern? And so it's really important to check in with your child, even if they're showing good behavior, and say, how are you doing? How are you feeling? Um, and then you can address what's going on with them to make future appointments or future experiences in a medical setting better. So the question is, when the child is cooperative but anxious, is that really the behavior we're seeking? And I think all of us would say no. The other thing I really want to address is the pushing back, and I have to credit Elisa here for for changing my mind about some of this, which is, when a child is questioning or pushing back, is that necessarily negative? And the answer is that it can actually be very healthy for them to be able to do that. The child's exhibiting confidence and expressing what they need, which is, these are important things to learn in life. So it's really the degree or the manner in which the child is pushing back. And if it's wildly disruptive, right, then we need to work with the child on ways to express themselves. And sometimes we need to give the child, realistic choices to help them have some sense of control. So I hope that's a straight enough answer. Um, so what we've discussed is misbehavior, expected behavior in a medical setting, will certainly depend on the developmental age or stage of the child. And so I'd really like to turn to our child life specialist, Gail, to say, can you tell us a little bit more about development, Gail, and how that affects the expression of these big feelings?
Thank you so much, Annie. Behavior does depend a lot on the age of the child and the developmental level of the child. When we think about children's behaviors, our expectations are very different for a young child versus an older child. For example, if we see a baby crying, we know that that's what babies do, and they're trying to communicate something. So that's not surprising. If we see a 5-year-old who's crying that just got a vaccine or a poke, that's not surprising either, and that's pretty much within the realm of what you'd expect a 5-year-old to do. Most 5-year-olds don't like getting pokes, and they will cry. But now when we think about an older child or a teenager or a young adult getting a vaccine or poke, if they're crying, you kind of wonder what's going on. That's not within what you'd expect of a 15-year-old or a young adult, like a 25-year-old. So again, the behavior is very much related to how the age of the child and their developmental level. And when I talk about developmental level, some children are slower at developing, so they might be 10, but in their developmental level, they may be 5. So we have to we have to really pay attention to that aspect of development as well. We can't just make the assumption that if it's a 10-year-old, they should be acting like a 10-year-old. Or if it's a young adult, they should be acting like a young adult. When it comes to taking medicine, it's the same type of thing in terms of their behavior. If we saw a baby who's given liquid medicine and they just spit it right out, that's wouldn't be it might be frustrating, but it would not be surprising because babies don't know how to say yuck, I don't like this and I don't want to take it. They just spit it out. And as children get older and they're able to communicate, say a 5-year-old, they also might spit it out, but you might be able to talk to them and say, maybe you can drink something strong after it, or maybe we can ask the doctor about taking something chewable if you don't like the liquid. So they're at an age where our expectations again change. And the same with even older children about taking medicine. As kids get older, if they don't like the taste of medicines, they can learn how to swallow pills, which actually one of our webinars, which I'll show you where it is, on the Boston Children's Hospital website. They can learn how to swallow pills. Another type of behavior that we can talk about in terms of development is whether or not a child can sit still. Again, you know, you would be surprised if if a 2.5-year-old sat at their chair quietly and just waited for their appointment. They're active at that age. Whereas again, when you talk about, you know, a 10-year-old, they should be able to sit in a seat and wait patiently, maybe read a book or talk to their parent. And then still another behavior that we might consider in terms of development and age is hitting. So if you see a 18-month-old hit their parent because they're angry and frustrated, you would, again, you know, they're old enough now to start telling them that that's not appropriate behavior, but it wouldn't be surprising. It would be surprising to see a 15-year-old, you know, hit their parent because they're frustrated. That's unacceptable behavior, and you would expect them to know better by that age. So a lot of what I've talked about has a lot to do with communication abilities. So again, 4-month-old babies, they cry because they're hungry, they're tired, something hurts them, they're cold. And so that's expected behavior. By 2 years old, children know the parts of their body. Typically, they can point to where they have a boo-boo. They can say their belly has a boo-boo or their arm has a boo-boo, so they can start to communicate what the issues are. And then when you talk about 5-year-olds, they can start telling stories. And so they're able to explain if they got hurt on a playground, what happened to them. They were on the swing and they fell off. And then when we get to even older children, they can think abstractly and they can apply logic, and you can talk to them in a different level and they can explain things in a different level. So all of those things contribute to what we expect in terms of their behavior.
Thanks, Gail. That's really helpful in thinking about, you know, how development forms what we can expect of children in a medical environment, and how their parents and caregivers, you know, might prepare them. And so can you share with us a little bit more about what preparing a child for managing big feelings in these settings might look like?
Absolutely.
Thanks.
You know, preparing children for medical visits can make all the difference in the world. And one of the things to remember that many of us know is that children learn through play, and they also can learn how to understand the process through play. So, for example, if the best recommendation for children of any medical level, like if they're going to just go in annually for their doctor's appointment, or a child who has illnesses, having a medical kit at home can make a very, very big difference. And if there's some inexpensive ones that you can order, there's also ways of making the equipment that I'll share later in this webinar. But if you have a medical kit for your child, a children's one, you can add Band-Aids, alcohol wipes if you have them, cotton balls, tape, anything around Q-tips, anything around the house that might be able to be used as medical equipment. And allow your child and encourage your child to examine their teddy bear or their doll or you, or take turns showing them how to use a stethoscope or a blood pressure cuff, and talking to them in language that is simple to understand. And as Annie mentioned, you know, kids have misconceptions of words with the stretcher. That can be the case as well with explaining the equipment. So for example, easy words to use for a blood pressure cuff will give a hug on your arm so that it's a gentle squeeze. So explaining about that, letting them practice, letting them get the sense of being in control of the situation can be very helpful. It's also helpful for children to know what to expect when they're coming to a doctor's appointment. So if you're not sure what's going to happen, it's fine to call the provider and ask what's going to happen. And that way you can prepare your child better. But for regular checkups, they're similar to what adults go through. Their children get weighed, they get measured, how tall they are. They'll have their blood pressure taken, their weight taken, and all of these things you can find in there are books, again, on Boston Children's Hospital website that are called My Hospital Stories that go through each step of what appointments will be like. And I'll show you how to get to those. But there's ones for going to your primary care doctor and what will happen at a typical primary care appointment. If you're going to an unusual appointment, you can also find out what your child's going to go through. And sometimes they can even tell you about different equipment that the child will see or what they'll experience. Another thing to talk about with your child to prepare them for appointments is how to relax. Children get very anxious. A lot of children at school are taught, the teachers often call it yoga breathing, which is doing slow breathing to relax when they're anxious. And basically what it is, it's breathing in through your nose slowly and then breathing out through your mouth. And some cues for doing this can be thinking about a bowl of soup, having soup. So you smell the soup, and then you blow on the spoon to cool off the soup. And you smell the soup, and you blow on the spoon to cool it off. And there's all sorts of fun techniques to learn how to do slow breathing, and to practice that at home can help when they get into a doctor's office. When I'm getting an IV placed, which happens periodically, I do that slow breathing to help me get through it. And it's very, very helpful, both for myself and for the person who's giving the IV, because my body's relaxed and it makes it easier. Another suggestion is to prepare an activity bag, maybe having a comfort item like a stuffed animal or a blankie, maybe a special toy that the child likes, a small toy, some kind of distraction item, a flashlight or a spinny toy, but maybe something they haven't seen before, even a new little book, something that can distract the child from what's going on when they're in the waiting room or when they're having something done in the doctor's office. And finally, I wanted to talk about during appointments and during like being in the waiting room. I know my first reaction when I'm sitting in a waiting room is to pull out my phone and start reading emails and text messages and, playing a game or reading the news. And when you're with your child, it's really important to give your child all of your attention. And so the phone should stay in your purse unless there's or your pocket or wherever, unless there's an emergency. And your attention should be focused on the child. And because you know your child best, if you see that your child looks anxious, you can help them become less anxious by talking to them, talking about what's going to happen, reassuring them about that you're going to be there with them, you'll hold their hand, you'll give them hugs, whatever it is that will help your child. You can remind them about the relaxation techniques that you guys have practiced. You can remind them about what to expect at the appointment. You can also talk about what might happen after the appointment. So you might decide that you'll have an extra story at night because they're going to cooperate during this appointment. And that story should happen even if they're not as cooperative as you hope they would be, because you want to associate something positive with the appointment, or start talking about going to the park on the way home, or, getting a snack. And it's important to remember as parents that children don't have to be perfect, that it's okay for them to cry and it's okay for them to be shy. The caregivers at the medical appointments all know that understand how children are scared and anxious and aren't surprised by behaviors like that. And you should also try to understand that your child's behavior really has to do with their development or their anxiety. And there's different ways that you might be able to help them. And on that note, I was going to turn to Elisa and talk about there's things that you can do that can help your child, but there's also things that you can do that make the situation worse. And so, Elisa, I was wondering if you could start with talking about what are things that parents do that make the situation worse for children in a medical environment?
Well, thank you, Gail. That was so helpful. Yeah, the preparation, just as Gail's talking, remember to prepare, prepare, prepare. It's so absolutely essential. Those resources and those ideas about what to do ahead are really important. And likewise, I think thinking about how you're going to manage the situation as well as your child's really important. I had a parent who said to me, I didn't realize that what I was doing was making it worse, and I didn't realize I could make it better and what a difference it would make. And that's been important. Um, that was really important to me, a gift to me in terms of knowing what to do to really help parents in these situations that are so challenging because it's nerve-wracking for us as well as it is for the kids because it's hard with your child, especially if your child's misbehaving and you're already worried about what the medical team is going to do or say. So I put it in that context of we understand it is a hard situation. But what not to do. I always hate to start with what not to do, but I think it's a helpful process because it's normal for us to be nervous or distressed at an appointment. And just to remember that if you show that, your child will feel that. They really look to you to see, is this situation okay and will it work out? And if you're excessively anxious or distressed, they see that and that is very communicative to them. So on the other side of that, there's the idea of using your Jedi power of using your own calm to help your child feel calm too. And part of that is knowing what you need. And if you need to bring someone else along with you, whether it's a friend, your own parent, a partner, ask those people to come if it makes it better for you to attend an appointment with your child. So when we're anxious or distressed, what other things do we do? Sometimes we exhibit embarrassment or, we express that towards our children. We're like, it's embarrassing, stop it. And that just actually adds fuel to the fire. That's where you do remember what Gail said. It's just, we know in the medical setting that children don't behave perfectly all the time and that, we've seen it before. So getting through and having your child feel better rather than expressing that to them in that moment is really important. And it's really a hard ask that I'm going to do next, which is not to give consequences or punishments for your child for their behavior in the appointment or to threaten them. Because it's like throwing gas on the fire to say, when we get home, here's what's going to happen. Now they're more anxious or distressed. That doesn't usually help anybody calm down. And it makes them think of the appointment as more stressful rather than less stressful. And we want to get through it as best we can with them feeling as good as they can about it. Now, it's going to sound like I'm going to say the absolute opposite, but you also have to set some limits and help kids understand what to expect in a medical setting. So one of the things when Annie was talking earlier about us not agreeing about what is misbehavior, we were watching a video of a child who was walking on chairs in the waiting room, and we didn't agree about whether this was misbehavior or not. And I was actually on the side of it's not really misbehavior, but does demonstrate that they don't know what to do. So when you see your child and they're getting wild, really cueing them about you could sit down here, what we can do is read, or we can look at a video on my phone together, whatever it is that cues them about the appropriate behavior in the setting is also important. And similarly, cueing them, like sometimes things happen in appointments that are hard for caregivers, such as the provider being late, or you're worried if they haven't read the chart, or you're feeling unhappy about something. I would advise you not to indicate it to the child in that setting. If you say something like, why are they always late here? Do they know what they're doing? That's obviously going to increase your child's anxiety in the setting. We're not suggesting that you don't have those concerns. And if you have those concerns, communicating them to your provider or the medical team is really important. So we can do a better job and get that feedback, but your child does not benefit from hearing that information.
It's so interesting that, how a parent behaves can really influence, and what they say can influence how a child feels. And that's really important to remember. That's a really good hint. What about what things caregivers can do to make the situation better?
Thank you, Gail. That's a really good question. Well, I want to say at the outset that we're going to give you a lot of suggestions, and we're not really expecting that you will take every single one of them. It's kind of like going to a shoe store and looking at a wall of shoes, you won't, even though all of those shoes are nice, you're not going to purchase all of them. You're going to find the one that you like that's the best fit for you. So similarly, you know your child. So you know your child and you know yourself, and they're the same child that was in other situations with you. So if if something didn't work for them in one setting, it's unlikely to work in the medical setting also. So picking what might work best for you and your child is what we're really asking you to do. And part of that is really remembering that you're the expert on your child and on yourself and their development, what they do, what scares them, what makes them happy, what distracts them, and use that information to really help you devise a plan to get through appointments and have them go as best as possible where the child and you feel like it was a successful appointment. And a lot of that has to do with what you were also talking about, Gail, which is the preparation and prevention. Prepare, prepare, prepare. I mean, I know everybody wants to hear about what to do in the moment when things are going wrong, and I will get to that, I promise, but you can prevent a lot of problems that never happen by really preparing and making a plan about how you're going to manage an appointment or a situation. And then you've just lowered the overall thermostat, so not as many things happen. Hmm. So what I'm sort of saying is develop that script. Gail's going to show you at the end how to get to the My Hospital story, which is a little bit about what's going to happen in an appointment. And that's useful to know. But I'm going to ask you to sort of think of your script beyond what's going to happen in the appointment, but also what you can do. What are the strategies you're going to use with your child, how you're going to think about it, how you're going to think about it for yourself, whatever age or development your child is. I mean, I think you still need to think about this with teenagers, with kids, with babies. How is this going to work the best for me and for my child so we get the best medical result possible? So part of that is putting in that structure and building in the predictability. I know I'm one who, when I was going to see my pediatrician with my daughter, I would always call ahead so I knew, was this the time we were going to get an injection or a poke, as we like to call it, or not, because it was helpful to know ahead. So part of this coping plan has to do with what strategies you're going to use. So when you're packing a special something to bring along for the appointment for distraction, if it's a teenager, maybe you give them a new game for their iPhone if they have one. For a baby or a younger kid, maybe it's toys that they haven't seen before. Novelty can really help if it's something they haven't seen before. That's going to be really useful in your preparation model. But, and Gail was talking, I love smell the soup, cool the soup. So you go, smell the soup, cool the soup. But if you've never done that outside of the appointment, it isn't as helpful. So you really want to practice some of these techniques and have them so that you can say to your child, is this time for smell the soup, cool the soup? And then it's something they've done before and they know about it. You can say, do you want to bring their favorite stuffy? Then you can take that out. Would you like to listen to a song on your headphones? Also knowing that and knowing who they are and how they're going to manage it. I had to get a shot recently, an injection, in my knee for cortisone, and it was really, really helpful. But as the doctor was beginning to do it, I turned my head away and she said, "You don't want to look?" I think she was surprised because I just said, "I'm not a looker. That's not how I cope best." So even knowing that about yourself, does your child want to watch what's going on or not? Do they want to be distracted or not? Knowing who they are and making that plan and them knowing your team is really, really useful for what you can bring. And also part of that is ahead of time thinking about their own strengths and their own coping. So how do you think you'll manage this in 5 years? Do you think this will even be difficult for you? It gives them hope of growth, ways they know that they're growing and going to do better in the future. And imagine how you would have handled this 2 years ago. You're getting older, you've learned to ride a bike. You can also use those kinds of techniques and strategies. And you can practice some of these things in play at home. So that medical kit's so useful, and they can practice exactly what's going to happen and pretend to be the very medical provider that they're going to talk about. I know that also talking to your team or letting them know who your child is an important part of the process, even ahead of time. I know I read a chart because you are the expert. You don't need to read a chart on your child, but I was going to see a new child and I read the chart And I found out that this child throws things at every psychologist that they've seen. So I went in ahead of time knowing that that was likely to happen. And I was grateful that I did, because when the child did throw the first thing at me, I could say, oh, well, what is happening? Does that usually happen when? What can you do instead? And that was the only thing that that child threw at me. And I think they felt better at the end of the appointment that they had overcome that behavior. Felt better to them and better to me to know and have a plan going in. I know something I like to do that's been important for coping for myself and for kids I work with is also that idea of what's their behavior that's challenging. So if they like to run around, a particular behavior that's useful for me is thinking about, like, thinking of myself as taller in the chair, feeling myself strong, feet on the ground. For kids, sometimes the idea of they're like a tree, they're strong, they're growing, their branches are reaching to the sky, the sun is moving, is making them grow, and that's how they're going to sit there as they receive whatever intervention that's likely to help them, because that's the other thing, to remind them that this is not a penalty, but this is something to help them. And that I think sometimes kids have that kind of misconception that this is happening because they did something wrong, and also important to let them know that this is something that might help them not get the flu, and or something along that line. So let's talk a little bit about in the moment. So all that preparation, sorry to interrupt myself, all that preparation is really useful, because it limits the number of problems that can occur. But what I can say is that's helpful because fewer problems happen, but it's not going to get your problems down to zero. And we don't even want to give that expectation. Sometimes kids are still going to have problems in the moment, and their behavior will be what we call dysregulated. So what do I mean by dysregulated? That means that it's not under their own control. They're running around, they're wild. They might be laughing, they might be screaming, they might be crying. Some dysregulation looks a little different for each child. But what I'll say to you about it is it doesn't, even if they're laughing, it might not feel good. Once I had a child running around my office and they were pulling things off and they were laughing, and it kind of made me more upset or mad myself, because it looks like they're having a good time at your expense. But once the child calmed down, I asked them, like, what was that fun? What did it feel like? And they said, they described it as hilarious was that word they used. And they said it was actually painful. It was kind of like the feeling you get when someone's tickling you and you're laughing, but it actually hurts and is not a good experience. And that actually helped me to retain some empathy for the child about, what is this dysregulation and how are we trying to pull it in? One thing that I want to add that is also a thing not to do, but I'm just going to put it in this list, is oftentimes when kids are distressed and unhappy in medical settings, parents feel for them, which I'm glad you do. Parents should feel for their children. But if it's saying things like, this is the worst thing ever, this is so awful, it's going on forever, things that enhance or build those feelings can actually make it worse. In this situation, what we're saying is not to dismiss their feelings, but not to enhance them. So if a child is scared, and you can say, I know you're scared, but I know you can do it. It's going to be over in a minute. That confidence that things are going to work out and it's going to be better for them. It's really important, because you start what we're going to call de-escalation. So in the moment, your strategy is de-escalation. And what that means is going from that state of dysregulation and wild, upset, and distress to calm, to a greater sense of calm as best they can do it. So how do we do that? So the first thing is listening to their concerns. If they're saying they're scared, I think you can listen. And as Gail said, look at them and pay attention to them and say, I know you're scared. But then we start with, I know you're scared. Here's what we're going to do. Referring back to the plan that you've made, we're going to do smell the soup, cool the soup. We're going to read a story. I know you can do this, those kinds of comments. But and pardon me, guys, I'm going to do something that's a little scary. I'm going to say something the way it's probably not the best way to do it. So your child's running around the office and you're like, sit down, stop it. Listen to the doctor. All right. Okay. So like I could see I scared Annie right there. Was that a little abrupt?
A little scary.
Did it make you feel calm, or did it
No,
actually dysregulate you more?
no, I got anxious very quickly.
So I think that's the key. We don't want
You
to do
scared
that.
me.
Sorry. We don't want to do it to our colleagues or our children. So think about the difference at I'm going to go up and try to say very similar words. If you use them simple, clear, and slower. Okay, you know what? I know you're scared. It's time to sit down. We're going to sit down. Very quiet, listen to the doctor. Those very similar words, but you have to pay attention to your tone, your volume, uh, and the speed of which you say it. Even sit down, sit down, sit down was a similar tone, but even if you lengthen it out and say, all right, we're going to sit down, we're going to pay attention to what the doctor says, we'll get through it quicker that way. It's much more calming, slower, and using that simple language. Think of it as your Jedi power, that the child is then calling on the same kind of tone that you are using. And you're also using your facial expression and your body movements to be calm. And also, you know your child. Sometimes putting a hand on their shoulder can make them feel better. Sometimes that can actually make them feel a little worse. So again, knowing your child, a lot of kids, it makes them feel better. But to ask a question like, would you like a hug? Would you like to sit in my lap? Those can be enormously calming. And also knowing that they have the choice not to do those if they don't want to. Reducing the sensory input. So if you're in a part of a waiting room that's loud, or you can ask, can we sit somewhere away from the action? That's also really helpful. Also, if there's two adults, have one adult be the primary person saying things to the child or giving them directions on how to manage it. More than one person can be more confusing and not as helpful. Getting down to the child's level without being threatening. So when I wanted to use that loud, threatening voice, I wanted to get in. So not like an intimidating stance, but like right at their level, giving them space, but also letting them know you're there with them. I'm here with you through this. It's good to have distraction. I love pop-up books, even for older kids, or, Where's Waldo kinds of books, because they're interactive. That can be more distracting than something you're simply listening to. But humor only if it's not at the child's expense. If you say something like, you're acting like a monkey, or like that could feel mocking, and that so not if it's something mocking. Express confidence in the medical team's approach. These doctors, these nurses, these social workers, these child life specialists have been doing this. They know how to help us. So it can be enormously helpful to get things going in a good way for your child. Express confidence also in the child's ability to manage the situation. I know you can do this. We've been this before. You learned to ride a bike. You can do this. Express that confidence and realistic choices when possible. Now, even saying all of this, how do we know if we're getting better? I hope you don't have a lot of medical visits, but one thing to look for is, are there fewer events, especially within the moment of them coming to a doctor's appointment? Are they less volume on the events? So are they less destruction, less running, less wild behavior? So we're looking for that. Fewer events, less volume on them. And also, how are they doing afterwards? Because your aftercare plan is also critically important. So how do you say to them afterwards, okay, so you got through it. That's amazing. The doctor only had to hold you for a minute, or the nurses or the team, and you did it. Reminding them of the positivity, because that positivity and the no consequences, but instead something positive after the event is gives them cues that they're going to, the next appointment will go better and that they did well. With that, I'm turning it to Gail for resources.
Yeah, thank you, Elisa. That's so helpful, all the hints you gave about parents, how they can help their child and help themselves during a medical visit. And now I'm going to show you how to access the Family Medical Coping Initiative website, which is part of the Boston Children's Hospital website. If you go to a search engine and you put in Boston Children's Hospital, you click Boston Children's Hospital, you'll see at the top it says patients and families, and then below it is clinical services. And below that is programs and services. If you click programs and services, it will come up with all the different programs and services that Boston Children's Hospital has to offer. And it's in alphabetical order. So if you scroll down to the F's, one of the first F's, F is family. Actually, it's not one of the first, but we're going to get to it. Here we go. Under family program, family connection program is Family Medical Coping Initiative. If you click on that, you'll get to our part of the website. And here you'll see all different webinars that we've offered in the past. This one will be added eventually. If you go to the first one, which is getting your child ready for vaccines and other pokes, and you open it, you'll see a little plus sign here next to the title, and it gives you all different resources. One of them is the My Hospital Stories that I shared with that we talked about. If you click the link, you'll get to the My Hospital Stories, and these stories are in the from the satellite locations as well as Boston's main campus, and they include all different types of visits that your child might need to go to. But most importantly is primary care, which is basically a checkup for your child. It's in Arabic, in Portuguese, and Spanish. So if English isn't your first language, that might be easier. If we go back, we can also take a look at another webinar, which offers a lot of information, is at the very bottom here, helping your child manage medical anxiety, strategies for coping. And if you open this one up, it has other resources. For example, how to make a stethoscope or a syringe out of paper. There's a list of different books you might want to borrow from the library or purchase for your child. For younger kids, like Daniel Tiger Visits the Doctor, or for older kids, My First Human Body book. So in each of the sections and each of our webinars has other resources that you can access. In this one also is My Hospital Passport. If your child's visiting, it has a list of different things that you can do, or My Go Bag. Remember, I talked about bringing a bag with you of different activities. That gives even more ideas for that. So I hope that you're able to access these and take a look at what might be helpful to learn about ways of helping your child with all different types of coping issues that your child might encounter. And I hope our webinar was helpful.
Oh, thank you, everybody, for watching and joining us. And again, to echo what Gail has said, is we hope that this was helpful for you in terms of thinking about your child's behavior and giving you some strategies for helping them cope and for helping you cope with being in medical situations. Thanks very much.
Thank you.
Thank you.